If you're on a GLP-1 medication and you're watching your face change or your hair, this is what the research says you can actually do about it. And it's something about these drugs that almost nobody in your feed is mentioning because it's not the scary part. But this stands alone. Let's start with the hair loss, because the patients asking me about Ozempic face are often also losing hair, and they're frightened, and they deserve a straight answer. The condition is called telogen effluvium. When your body experiences significant physiologic stress and rapid weight loss absolutely qualifies. It looks alarming, but it's not permanent damage to your hair follicles. The current evidence links GLP-1 associated hair loss to the weight loss itself as the trigger. Once your weight stabilizes, the follicles tend to recover. It usually reverses in 3 to 6 months, even if you continue on the medication. Topical minoxidil may also be helpful during this period. Now, the part your feed isn't telling you. The same 2025 systemic review that documented the adverse skin effects of GLP-1 medications also documented beneficial ones, and they're real. Patients with psoriasis have shown measurable improvement on GLP-1 medications. The anti-inflammatory effects of these drugs appear to modulate the cytokine activity that drives psoriatic flares, and there is emerging evidence for enhanced wound healing. For patients with inflammatory skin disease and obesity, GLP-1 medications may be doing more for their skin than we originally anticipated. The conversation about these drugs in dermatology cannot be entirely one-directional. So what can you do if you're on a GLP-1 and you're seeing facial changes? The most evidence-informed thing is also the least exciting. Slow down the rate of weight loss if you can. The research consistently shows that facial aging is more pronounced with rapid weight loss. Slower weight loss allows your skin more time to adapt. Talk to your prescriber about your titration schedule. Protein intake matters. Your fibroblasts need amino acid building blocks to produce collagen. If you're eating significantly less on these medications, which is the point, make sure protein is not what's being sacrificed. Strength training preserves muscle mass and supports skin structure. At the clinical level, retinoids support skin quality and collagen turnover, relevant both for prevention and for patients already seeing changes. For those with significant facial volume loss, biostimulatory injectables and radiofrequency microneedling are evidence-informed options worth discussing with your dermatologist. The bottom line, GLP-1 medications are genuinely remarkable drugs. The dermatologic picture is more complicated than the before and after weight loss photos in both directions. There are real adverse effects on skin structure that patients are not being warned about. And there are real benefits for inflammatory skin conditions that patients are not being told about either. Both things are true at the same time. Stay curious, because depth beats noise. And if someone you know is on one of these medications and watching their face change, send them both parts.